Hi, I am Dr. Avinash Tarele, your medical oncologist from Restore Onco Care Center. Today, I am going to discuss with you all that you need to know to win in this challenge against head and neck cancer. Let us see at some warning signs of oral cancer. Time is the only currency while dealing with cancer. Unhealed or chronic ulcers for more than 2 weeks is a big red flag. You have to act immediately. Along with these oral ulcers, there are other warning signs and symptoms. First is erythroplakia or leukoplakia, a white or a reddish purplish patch inside of your mouth. Second is unexplained pain in ear or throat. This can be a referred frame from a pain sensitive structure in your oral cavity. Third is loose or falling teeth in absence of gum disease, or an extraction has been done but that part is not been healing for more than 2 weeks. That is again a big red flag. Fourth is hoarseness or alteration of the voice. Fifth is lump in the neck or feeling of palpating some lymph nodes in the neck. They are also a telltale sign of an oral disease. If we have any of these, visit your ENT specialist or a dentist. The way we diagnose head and neck cancers is by doing a biopsy. And I want to tell you one ridiculous myth that biopsy spreads cancer. It is absolutely nonsense. Biopsy is the most important investigation to diagnose the cancer. Not just in India, but globally, everywhere under the sun, biopsy is mandatory to diagnose cancer. Next is people oftenly ask us, doctor, why some patients directly go for surgery whereas some patients go for chemotherapy followed by surgery? Well, the standard treatment in head and neck cancers is surgery, of course, but in most cases, when we diagnose the disease in later stages, when it is locally advanced, we have to give something called as NACT, that is neoadjuvant chemotherapy. This is chemotherapy given before a definitive treatment. The goal of this treatment is to shrink the tumor and make it small such that it is made free from the surrounding critical structures and help the surgeon to get a clean margin and complete dissection, taking it out completely. There can be various indications for neoadjuvant chemotherapy. In head and neck cancers, usually 2 to 3 cycles are given before surgery in case of locally advanced disease. In oral cavity, such as in cancers like buccal mucosa, tongue or lips, NACT is usually required when we have T3, T4 tumors attaching critical structures like base of the tongue, zygomatic bone arch, or edema of the skin involving nerves and major blood vessels. Coming to nasopharynx usually it is chemotherapy first followed by radiation because those nasopharyngeal tumors are highly chemosensitive. Coming to laryngeal cancers, supraglottic cancers, we give chemotherapy first 2 to 3 cycles followed by radiation. Here we avoid surgery because we want to preserve the voice. We want to preserve the larynx. It's called as organ preservation protocol. This is the way chemotherapy, neoadjuvant chemotherapy helps our surgical colleagues to have a clean dissection with clear margins and help preserve critical structures like lingual nerve and facial nerves. Common question that people ask is, why do you need a qualified oncosurgeon or a head and neck surgeon to do the surgeries? Well, cancer is a formidable enemy and we only get one chance to address it. So, it has been proven beyond doubt that highly skilled oncosurgeons and head and neck surgeons have the ability to remove the disease completely, ensuring preservation of critical structures. They help us get clear margins. Now, clear margin is defined as margin at least 1 centimeter around the tumor. Sometimes that is not possible, say in the base of tongue or other parts, but still what is best possible, they help us get it with us. So a qualified oncosurgeon, qualified head and neck surgeon is very important to ensure cure. They, along with plastic surgeons, sometimes are needed to form reconstruction and have rehabilitation. Also, the oncosurgeon will do the meticulous neck dissection, which is absolutely necessary to prevent the disease of spilling over into the body. People often ask, what is radiation, when it is given, and why it is needed? Once the surgery is done, the surgeons can remove only what is visible to their human eyes. Even though having a clear-cut margin, there are microscopic cells or microscopic seedlings of disease which are not visible to human eye. These seedlings are sometimes the cause of relapse. In order to achieve local control, radiation has evolved over the years and is the standard of care in preventing risk of recurrence. Radiation is usually given 5 days a week for 20 to 30 days. It is given in the form of daily fractions, which kills the damaged cells and the cancer cells and allows the normal cells to recover. It is usually given in high risk features like 4 or more lymph nodes positive, perinodal extension, or perineural invasion. Along with that, sometimes we need to give a mild form of chemotherapy which sensitizes the cells so that radiation acts in a better way. Also, people ask what is targeted therapy and immune therapy? Like in any other disease, even in head and neck cancer, there are identifiable actionable mutations. They are called as EGFR mutations in head and neck cancers. EGFR mutations, they drive the growth of the cancer clone. Over a period of time, we have evolved specific drugs called as cetuximab, which help bind these EGFR receptors and augment the impact of chemotherapy. They are the standard of care in bulky disease and relapse settings. So, targeted therapy definitely helps to augment and improve the responses along with chemotherapy. Immunotherapy is the new kid on the block. By doing certain testings like PD-L1 tumor mutation burden, we can identify those subsets which are going to be extremely responsive to immunotherapy. Immunotherapy activates our normal body defense mechanisms like NK cells and T cells and augment their responses so that they go and control the disease. Immunotherapy is also a standard of care, and as India is the global capital of head and neck oncology, we have been fortunate enough to discover and offer a gift to the world in the form of low dose immunotherapy. So the oncologists at Tata Memorial Center and the colleagues, they have formulated and proven that beyond doubt that low dose immunotherapy is also as equally effective as standard dose immunotherapy in certain cases of head and neck cancer, wherein they have shown the same efficacy by reducing the dose by 1/4 of it, reducing the cost 1/5 of it, and ensuring equitable distribution and access across the societies to many people. This is a gift from India to the global oncology. Also, along with this, you don't have to forget the most critical and important part is the nutrition which goes along the treatment. Nutrition is important during the chemotherapies, during the radiations. It ensures that you have a fast recovery and getting back to your life as early as possible. Remember to maintain your weight. If you maintain your weight, we assure you, you won't even spend an extra day in the hospital. Sometimes you need rehabilitation in the form of speech therapy and voice therapy, which the occupational therapist will help you out. If you or someone you know is facing the diagnosis of head and neck cancer and dealing with this challenge, please understand head and neck cancer is a formidable enemy, but it's not invincible. At Restore Oncocare, we ensure cure with compassion and we treat big people with big lives. We ensure that you have a good quality of life along with cure. We usually bring the best of the chemotherapy protocols, neoadjuvant chemotherapies, have best of the oncosurgeon teams with us who ensure clean dissection with highest standard of care. So if you or someone you know is dealing with head and neck cancer, share this information with them, empower them. Let's win this together. Stay positive, stay informed, and most importantly, stay hopeful. Let's win this battle together. Thank you.